Hello, everyone. My name is Andrew Brandenburg, and my core content area was clinical psychology. Now, I wanted to look specifically at some applications of clinical psychology to stress management. Clinical psychology is a very, very broad and complex field, and it could be difficult to distill a useful two kind of terms into a 20-minute presentation. So today we'll be looking a little bit at the ideas of stress management and stress theory, and then applying some principles from cognitive behavioral therapy to stress management as well. Now, before we get started, we should probably talk about what is stress. So, show of hands, who here has felt stressed before? We'll wait for the hands to raise, and then I'll ask. So, some of you who raised your hands, could you describe that experience to me? What would you describe stress as being? We're looking for bad feelings, tension, pressure, reaction, anxiety. So, okay, so we see some common themes here. Generally, we have an emotional component. It's generally triggered by something, and it generally isn't a good thing either, right? We should get that out of the way. Now, here are some ideas of what stress is from other sources. The World Health Organization says that stress is a state of worry or mental tension caused by a difficult situation. Mind.org says stress is how we react when we feel pressure or feel threatened. The APA, in a stereotypically wordy response, says that stress is a normal reaction the body has when changes occur, often resulting in physical, emotional, and intellectual responses. Physics text says that stress is a physical quantity that describes forces that are present during deformation. And MedlinePlus.gov says that stress is a feeling of emotional or physical tension. Now, as we can see, stress has a ton of different definitions. Obviously, we reached a little bit outside of the world of psychology for some of these definitions, but there are some key themes here. Stress is generally a force that we feel is acting upon us. So stress has those words of tension and pressure. We associate that with stress. Stress tends to be triggered by something. It's a reaction. It has physical and mental effects. We could physically feel stressed. We could mentally feel stressed or emotionally feel stressed, and it tends to last, right? Um, Stress is both a reaction, so there is a component that happens right when we become stressed, and then there is a lasting effect after the initial presentation of the stressful stimulus. Now, this brings us to Hans Sell and his stress theory. Hans Sell was an endocrinologist. I guess I didn't put that here. So Hans Sell was an endocrinologist living in Canada from 1907 to 1982, and he coined the phrase, stress is a concept which is too well known and too little understood. Sell realized in his time that everyone was taught, or everyone was kind of addressing stress. We all kind of knew that it was there, but nobody had taken the time to really define what stress was. He, being an endocrinologist, was very interested in more of the physiological side of stress and kind of the methods of the body regulating itself and communicating with itself and maintaining homeostasis. So he took a more physiological and process-oriented approach to stress. He identified three primary stages in our stress process, is what he called it. There is the alarm stage, the resistance stage, and the exhaustion stage. There is the trigger or the stimulus, there is the automatic response, and then there is the lasting response after or the lasting effect after the response has run its course. And he named this general adaptation theory. General adaptation theory in the rough kind of looks like this. We are presented with our stressor. It's either internal or external. It's acute or chronic. It's either controllable or not. Coping is then step two. That's the resistance stage. Coping is kind of the automatic response that our body takes. That could be an increase in heart rate, an increase in blood pressure, increase in cortisol. It could be a physical effect as well. Maybe the first thing we do when we feel stressed is we tense up, or maybe we stand up when we go for a walk, or maybe we punch a hole in the wall. Just depends on who you are. And then step three, the exhaustion phase, is the stress response in the diagram here. And that is where we feel kind of after the initial psychophysiological response has run its course, that is where we then feel exhausted or let down, or that's when we feel kind of that overwhelming pressure that we can't always even explain. That's our perceived effect after the coping. So if we operationalize stress, stress is an interaction of stressors and our responses. There are psychophysiological events that moderate this. Stress is not just how we feel. Stress can also come from, or stress is also a result of a trigger, a result of a stimulus. It has its roots in our evolutionary responses, so that comes from our fight or flight reaction. Back in the caveman days, if you were presented with a stressful stimulus, you could either fight it or run away from it. But when we're sitting at our desk in an office job, we can't really do either of those things, and that leads to that kind of perceived affect, that kind of tension that we carry with us after the initial response to the stressor. We associate stress with bad feelings generally, pressure, fear, anxiety. And that's why we care, right? We don't like being anxious. Stress has also been associated with increased recurrent or increased occurrences of hypertension, heart disease, and obesity, either due to maladaptive practices or just due to the overall physical strain being put on your body by stress. Stress can also lead to depression. Now, something that I didn't illustrate here, but the Department of Labor and the World Health Organization actually both estimate that we lose about 60 million working days per year due to stress-related illness. It's not always people calling out saying, I'm having a panic attack, but by most estimations, people suffering from burnout or just physical exhaustion, mental exhaustion, even emotional exhaustion, account for about 60 million working days a year of absenteeism. It's about $7 billion globally. So if this was not enough of a humanitarian reason for you to care, then we can look at the money in the bottom line and say we should still address the kind of stress epidemic due to that. Now, what can we do about stress? We've got a couple options. The first thing most people think of is that they change their lifestyle. We manage our time better, we organize ourselves, we have a calendar, we make sure we're getting enough sleep and exercise. Some people may medicate. They may use pharmaceutical medications like prescribed meds, or they could use, over-the-counter, even illicit substances to medicate themselves. But a weakness of the lifestyle change approach is that we are kind of addressing the symptom and not the cause. We are always going to feel stressed, and we just decide what we're going to do about it. Whereas the medication response, similarly, is kind of nullifying or softening our reaction to stress, but it's not really eliminating the trigger or the overall chronic condition as a whole. We could reach out to social support systems. You could go talk to your family, your friends, you could vent, you could ask for advice, but that's not always sufficient. And sometimes we could be, putting our burden onto others, or sometimes others may not be giving us the best tools to handle the stress that we're experiencing. And then we have plenty of other coping mechanisms that don't really fit inside a category. A lot of people throw themselves into their hobbies. They could, really dedicate themselves to exercise, or they could just work. So generally we tend to distract ourselves or kind of hide away from the stress or just focus on something else rather than dealing with the overall condition. Or we could ignore it and avoid it. We could just do nothing. We could just say, well, life is stressful. We're just going to deal with it. It is what it is, right? Now, not a very optimistic outlook on what we can do about stress. So along comes Aaron Beck. Now, Aaron Beck has won the award for friendliest looking psychologist, I think. But no, he was around from 1921 to 2021. He died a little over 100 years old. He was one of the top 5 most influential psychotherapists of all time, and he is the father of cognitive behavioral therapy, or CBT. Now, the basis of his ideas for CBT came about when he was performing therapy with depressed patients, and he noticed this tendency for people with depression and anxiety to engage in what he called cognitive distortions. So that was kind of irrational thought patterns that were not based in reality, but the patient was still allowing these irrational thoughts to determine their reality, or to determine how they thought about themselves and how they acted. So he came up with cognitive behavioral therapy. Oop, those are out of order. So some of the core ideas of CBT is that we identify and challenge these negative thought patterns and behaviors. Now, specifically the automatic ones. So let's use an example for the rest of this presentation of you are working a desk job, you're sitting in your cubicle, you already feel a lot of pressure about some projects you have coming up this week, and then your boss comes by and puts another project on your desk and says, I need this done by the end of the week as well. So some immediate irrational thoughts that you may have is things like, oh my God, I'm going to die, I'm drowning, I'm going to get fired, I'm never going to make it, I can't handle this. Those kind of thoughts may be the first things that kind of pop up into our head. Maybe not in those words, but those feelings are associated. Cognitive behavioral therapy would have us kind of investigate and look at those negative thought patterns as they occur. And then later on, we can use the 3 C's to catch it, so we notice it, we check it, we say, is this rational, is this not, am I really going to die if I have too much work? And then we can change it if it is irrational. We can kind of reframe or adjust our thinking. Instead of I'm going to die, it's just I have a lot of work, maybe I should organize. And we'll get into some more of those strategies in a moment. So there is this kind of in this diagram, we recognize this connection between thoughts, emotions, and behaviors. We have to realize using CBT that all 3 of these things can influence one another. Our emotions may determine our thoughts may determine our behaviors, and our behaviors can then influence our emotions. The cycle works in reverse as well. And then there's this kind of core central idea in CBT of power through awareness. By educating yourself or by educating your client or your patient, you do empower yourself to resist these kind of negative effects and these negative things that occur in our lives. And so when we combine CBT principles and the general adaptation theory together, we get kind of this unified stress process model here. So we have our original three, stressors, coping, and stress response, that we've talked about already, but we can add these two additional variables, the individual predispositions and the buffers category. Now, individual predispositions we're going to kind of breeze past because there's not much we can really do to change our personalities or our genetics, but those are the kind of background influences that that are kind of inherent to you as a person that can moderate your stressors, your coping, and your response as well. Buffers, on the other hand, are still background factors that can influence coping and our response, but they are more achievable or more able to be cultivated. These are things like the availability of social support, your level of physical fitness, your general idea of self-efficacy, meaning of life, all of these kind of things, even your ability to have a sense of humor, could all be considered buffers that kind of step in between the coping and stress response phases. Now, the nice thing about CBT is that CBT allows us to influence or moderate each of these steps minus individual predispositions kind of along the way. So there's plenty of tools that we can use for all steps of our stress process model. We're going to start by looking at stressors. So this is something called stressor analysis. Sometimes we call this stress inoculation or stressor manipulation even. Stressor analysis works on that first kind of area, the first phase of a stress response. So that is the immediate presentation of the stressor. So stressor analysis would have us kind of be made aware of how our initial reactions kind of influence our responses here. Now, we do want to identify specific stressors and triggers, so this goes back to the idea of power through awareness. So by instructing your patient or educating your patient on how to kind of analyze their stressor and kind of break it down factually, you do remove some of the immediate power from the stressor. There's kind of a situational breakdown that happens where we can say, in the cubicle example, the boss puts the paper on your desk. Now, immediately you just feel freaked out, right? But we do want to look at that and say, what is it that's making me feel stressed? Is it the presence of paper on my desk? Was it the fact that my boss came by? Or is it the idea of having more work added to my pile? Obviously, in this case, for most of us, it's going to be the third option, the work being added to the pile. So we then want to break down that stressor some more. We want to say, is this an acute stressor or is this a chronic stressor? Am I stressed about this particular task, or am I stressed about all the tasks and all of the kind of background stuff I've got going on at the same time? Now, it could be some combination of both. In this case, I'd say that the acute stressor kind of triggered that immediate response, but it kind of just brought our awareness to the existence of our chronic stressor, that overarching kind of demand that's being placed on us. We can also ask, is this controllable or not? Is it in my power to remove the stressor or do something about it, or is it uncontrollable? Now, in this case, it's controllable, but in some cases, like if you're stressed because you're stuck in traffic and you're going to run late, that's out of your control, and we may want to influence our coping behaviors accordingly, because, what's the point of getting yourself worked up over something you can't change? So we're going to move past stressors onto coping. So coping is our initial response, usually our automatic response. There's not much conscious thought that goes into the initial coping step. So this is the paper is put on our desk is the trigger, and then our immediate kind of feeling change or physical activity within a few seconds of the stressor being presented is our coping step here. Now, cognitive behavioral therapy is full of ideas for coping skills. There's this core idea of cognitive restructuring and cognitive reframing, in which, again, going back to those 3 C's, we want to catch our thoughts, check our thoughts, and change our thoughts if we need to. Now, a lot of the cognitive behavioral therapy is indicated in the treatment of anxiety and anger and depression, these kind of dark kind of emotions here, and those are associated with stress. So there is some support, or it does lend some support to the idea of CBT working with stress management therapy. So yes, CBT therapies for dealing with anxiety may apply to stress management, but there is some difficulty in the research specifically kind of proving or supporting the idea that stress management specifically is a good use for CBT, because CBT does operate on the principle of catching irrational thoughts, and more often than not, unfortunately, the things we get stressed about tend to be rational things. Maybe you should be worried about getting your work done. Maybe it's not irrational to worry about paying the bills, all of these things. So it can be a little awkward sometimes directly transplanting these strategies from CBT to stress management. However, some tools in the CBT tool belt that will work for us are the ideas of self-monitoring and goal setting. So rather than hyperventilating as soon as you are presented with a stressor, maybe the first thing you should do is monitor yourself. Say, okay, I noticed that my blood pressure went up. I noticed that I'm feeling stressed, but I need to accept that, be okay with that, and then maybe move on to something constructive like adding this to my calendar, maybe adjusting and shuffling some goals, keeping that kind of clarity and logical thought as we progress through the stress process. The idea of mindfulness is a central idea in CBT. We're going to talk about this again when we move on to the stress response moderation. But mindfulness is kind of this practice of grounding yourself and just being present and aware of your own cognition, kind of like metacognition in some cases. And rather than being whisked away and running away with your anxious thoughts, kind of looking at them for what they are and working through them in the moment, being grounded and present there. Now, these strategies, there are several others that we could cover, but they have been shown to be moderately effective. But again, it is a little tricky to kind of empirically prove that specifically for stress management these work, because they are more indicated for kind of general anxiety, and there is that kind of awkwardness about calling stressors irrational sometimes. So again, some additional coping mechanisms. We could reframe our rational thought patterns. We could adjust our behavior. We could adjust our sense of urgency and prioritization. This one's pretty interesting because it is shown to return a level of control and self-efficacy to the client. Sometimes we just feel helpless when we're stressed, and so by organizing your work into most urgent to least urgent, most kind of the temporal relations, like what's due first, what's due last, you do give yourself some control over your stressors, specifically in kind of a work-related area. And then there may be some more everyday tips that a CBT therapist could provide their patient, just depending on the situation. CBT is very big on the idea of kind of doing your homework and kind of your self-study, self-improvement. So there are plenty of kind of more niche applicable things that we can use as well. So returning to the stress process model, we've talked about stressors. We moved from the stressor to coping. We're going to take a pit stop with buffers before we end up with the stress response. So again, buffers are the kind of intermediating variables that can moderate our transition from coping to stress response. They generally exist in the background, and they are things that kind of can help us kind of vent or take away some of the pressure from the stress that we feel. So CBT also has an answer for this. We can create some buffers. Again, is the variable between coping and response. So some ideas as kind of social support interventions. CBT is big on this idea called behavioral activation, which we'll talk about later, but kind of engaging in activities that you enjoy and enjoying them in the moment to kind of remove some of the kind of maladaptive like tunneling that we do, the rabbit holing. So social support interventions, you could engage in group activities. Some psychology of group dynamics tells us that there are three main types of support when it comes to groups. There are emotional groups, which kind of are your friends and family that you can vent to and get emotional support from. There are informational groups, which can provide us informational resources. That could be like a trusted coworker that you go to and say, hey, I know that you did this project before. Could you give me some pointers? And there are instrumental groups that can provide actual material or physical actionable help. That could be someone doing you favors. Maybe you say, I'm going to pull a late shift. You call your neighbor and ask if they can let your dog out. Any sort of material goods that they can provide as well. That would all fall under the idea of instrumental support groups. So a therapist may support the idea of a client engaging in more social behaviors with these specific groups, or maybe even just having the client identify the kind of flavor of group that they have could be useful as well. Now, there's also humor therapy. Humor therapy is kind of a little outside CBT, but it was interesting, and I wanted to talk about it a little bit in the presentation. So humor has actually been shown to moderate our stress response. That's the step between coping and the kind of chronic stress that we feel. Humor can kind of put its foot in between and kind of reduce the amount of chronic stress that we feel. There was an experiment done in 1996 by Newman and Stone in which two researchers had a group of participants kind of watch a kind of gory and disturbing video. And then one group was asked to recount the events of the video in kind of as precise a manner as possible. Make sure that you don't leave anything out, just be very accurate. And the other group was asked to recount the events in kind of a comedic way. Try to make yourself laugh, try to make me laugh. And through measuring the galvanic skin response and kind of PET scans and other physiological biomarker tracking, the researchers were able to prove that using humor as a method of processing the kind of stressful event, being the video, was actually shown to reduce our physiological stress response, which is pretty interesting. Thought it was worth talking about. There is very little research on the efficacy of specific types of buffers. So some buffers we didn't talk about is like maintaining a level of physical fitness, having enough sleep all the time, being fed, and good nutritional adherence as well. There is research on the efficacy of all of these things individually, but it's very difficult to say which would work best because individual needs and individual situations often will vary. So returning to our stress process model, we have worked through stressors, coping, we've taken a pit stop in buffers, and we're now going to end on stress response. Now, stress response is the kind of lasting effects of an initial kind of stress reaction. So after our heart rate kind of elevates, after our blood pressure elevates, after we do our breathing and mindfulness exercises, we're then left with this overall kind of doom and gloom, dark cloud of stress if we didn't do a good enough job. And we'll talk about that. So this falls under the category of response reduction techniques. Sometimes it's called arousal reduction. But how do we kind of work through stress posthumously after stress has impacted us, and while we're carrying that burden, what can we do about it then? So the first thing, again, power through awareness. We're going to help our client recognize signs of hyperarousal. Sometimes we can be stressed chronically and we may not even realize it until we have kind of, the straw that breaks the camel's back and we snap. So we want to educate ourselves and be more aware of our internal responses to stress and be aware of when the load is kind of stacking up on us as well. We are then going to provide techniques to reduce the reaction, to kind of eliminate that chronic stress that we're carrying with us, that overall stress response. So again, back to mindfulness, but this time adding meditation. These are two that are very commonly used in CBT. Meditation is, again, a process of kind of grounding yourself in the moment, looking at your thoughts rather than being whisked away by your thoughts is how I remember it. And mindfulness is kind of keeping yourself grounded as well, and kind of keeping yourself in reality and not letting yourself be lost by these negative emotions. There is behavioral activation, which I mentioned earlier, but behavioral activation is kind of intentionally doing activities that you enjoy, engaging in behaviors that are constructive and that bring you pleasure, and kind of living in the moment for those, because that can help reduce tension, and it kind of changes our overall cognition about the world around us. It can kind of influence us to see the bright side of things, to use more Jungian archetypical terms there. There is the idea of progressive muscular relaxation. Now, they use this in the military for sleep, but it is also good to just kind of de-stress and relax yourself. So a CBT therapist may send their client home and say, I want you to practice doing PMR. What that usually entails is kind of laying or sitting in a comfortable position, and then typically from your feet up, tensing each muscle group consciously, and then kind of consciously relaxing and letting go of that tension and maintaining regular breathing as we do it as well. And kind of working your way up the body towards the head as a method of kind of physiologically deprogramming, releasing all that tension, and returning back to kind of a normal cognitive state. All of these methods have been proven to be highly effective. This was a study that was actually very recently published, kind of comparing the use of meditation and mindfulness to the PMR and some other CBT principles in the management of anxiety, but they are kind of analogous with stress management. So very promising application of CBT to reduce our responses. So in conclusion, some things we can take away today. CBT principles are shown to be effective at all steps throughout that stress process model under Sales' general adaptation theory. It does tend to outperform our other methods of like self-medication and purely behavioral approaches to dealing with stress, because it does provide us the awareness of the process, and it shows us, or it gives us the tools to address each step along the way, rather than just kind of hiding ourselves away from the stress or ignoring it or moving on. There is still a difference, a noted difference between stress management and anxiety, general anxiety. So remember, a lot of these principles come from the treatment of general anxiety and anxiety disorder, but there is some useful crossover between the two. More research will need to be conducted before we can conclusively say that CBT is the best way to deal with stress, because again, there all are these individual factors and predispositions that can influence what it is that a client needs. Here are my references, and I will open for questions.